Susan, it is such an important issue. I'm curious why, I mean, because there are so many things you've been involved in. Why did you connect to this one?
We should know if you have the luxury of having insurance and you have an operation or a procedure that you're going to go into the hospital, to be able to know ahead of time how much it's going to cost, and to, if you're lucky enough, be able to shop for the hospital that gives you the best price. January, a law was passed that nobody knew about that says that a hospital has to tell you, that they're obligated to tell you, as you saw in that spot, but nobody knows it. And obviously the hospitals are not going out of their way to, volunteer this. So hopefully this campaign tells those people that are lucky enough to be able to have insurance to shop around, and that they have a right to know ahead of time if the aspirin that they're given is going to be $50, or if, there's going to be any added on costs. Healthcare is the biggest reason for bankruptcy in this country. I mean, it's just unbelievable how many people get wiped out, even with insurance, when cancer hits or something hits. And so hopefully, if it's more transparent, then maybe there'll also be the need for hospitals to be more competitive with the prices that they do charge. Because people don't have insurance, now they put off going to the doctor. They don't get eyeglasses. I mean, our need for a better healthcare system, also in times of non-emergency, becomes emergency because people don't go to have a mammogram. People don't go to have these preventative things that, if they were caught in an earlier stage, would be less expensive and you'd have a better chance of surviving, and that's also screwed. It's just, it's terrible that all these years we've accepted this idea that you're at the mercy of corporate America, and that you don't have a right to health care as a working person in the United States. We should all be covered. We should all be covered.